Well, hello, I'm Anne-Marie Dose. I am a clinical nurse researcher in the Division of Nursing Research in the Department of Nursing at Mayo Clinic. Well, I've been a lifelong student. I started out actually with an associate degree in nursing. Then I went back to school for my baccalaureate degree and my master's degree, vowing that I would never go back to school. But never say never, because then 11 years later I went back and worked on my PhD in nursing at the University of Minnesota. And I've had a long and varied career, all of it at Mayo. I've been a nurse almost 40 years. I started out in the hospital setting in med-surg units, and then I actually then went and spent 17 years in the cancer center, which was a wonderful experience. I spent a number of years working as an outpatient chemotherapy nurse, but then my career has always had a unique combination of clinical and research components to it. Most of the work we did with chemotherapy, about half of the chemotherapy regimens were clinical trials. Also, what was going on at that time, there was an emerging program in cancer control, and I worked with Dr. LaPrinzi on those studies for a number of years through the North Central Cancer Treatment Group. And I was the co-chair of the nursing board for that for a number of years. From there, I went on to be the first advanced practice nurse with the Women's Cancer Program, which again was a combination of clinical and research studies, and that was very intriguing. But then I longed for a different avenue, and from there I went and actually worked in hospice. So I worked with Mayo Hospice for about a year, year and a half, which was very eye-opening, seeing care delivered in the home and having a lot of autonomy in that role. From there, then I came back to the hospital setting and worked as a clinical nurse specialist for some of the surgical units. So I kind of went from one end of the cancer continuum to the other. So the majority of my career has been in the field of oncology. After that, I got the research bug again, if you will, and then became a King Hussein Scholar, and that's when I embarked on my nursing research journey. And then I've been with the Division of Nursing Research for the last 9 years. Well, my program of research, as you can see from my clinical and research background, has emerged into palliative care. I feel like everything I've done up until this point has led me to this. So some of the research I've done has been on spirituality of end of life with hospice patients. I've just finished up a huge study with Dr. Elise Carey from the palliative care team, and Dr. Barbara Koenig from Professionalism and Bioethics on the quality of death and dying in the hospital, where we interviewed family members of 100 patients who had died in the hospital here in Rochester. We also expanded that study to Florida and Arizona, doing the same very complex survey of care in the final weeks of life in the hospital setting, what care was like at the moment of death and immediately afterwards, and then follow up with them on bereavement needs and expectations of services from Mayo Clinic afterwards. A few months after that, then we followed up with a subset of 20% of those participants with a qualitative interview to give us richer and deeper data. So we are working on manuscripts and presentations for that at this time. As we are rolling out the results from our quality of death and dying study, we have presented some of those findings to the hospital administration leadership, and some of these findings directly lead into ongoing work with providing standardized checklists and tools to staff to ensure standard practices are followed at the time of death. And I think this is particularly helpful for patient care units where, fortunately, death does not happen often, but they want to ensure that they're doing everything that they should. I think another thing that we found with these surveys, that I think it validated the good care that is being provided, but there are certainly always opportunities for improvement, so we continue to disseminate that work internally and externally. Well, I've always had a passion for psychosocial care throughout my whole career, and wanting to ensure that patients and families have certainly their physical needs met, but also their needs for emotional support, for spiritual support, and to maintain the integrity of the person. Those have always been very important to me, both in my clinical practice and in my research. So that's what really drives my passion for the work that I do and that I plan to be doing in the future as well.